Welcome to the next generation of anti-aging applications, treating wrinkles, pigmentation, and redness with Cynossure's latest innovation, the Affirm with Cap technology, a revolutionary laser system to make your practice more efficient and profitable with increased safety and comfort for your patients. The Affirm is a 1440 nanometer ND YAG with exclusive combined apex pulse or CAP technology. CAP technology delivers over 1,000 diffractive micropulses within a 10 millimeter spot size, reaching a depth of approximately 300 microns, directly targeting the zone of photoage skin. Through a combination of high and low-level heat intensities, CAP controls thermal damage to simultaneously stimulate and remodel collagen. The combination of heat ensures the wound healing process to happen more quickly and effectively.
Typically, the damage that we see from ultraviolet exposure over the years extends about 300 microns into the dermis. The thing about the Affirm is that we're actually targeting that photo-damaged area. So when we look at this histologically, we find that the microthermal zones are actually going down to 300 microns. And we find that clinically, and in our studies that we've done, that we are getting excellent improvement, and it appears that 300 microns is a very safe distance to target and is also a very effective distance to target. So we have the clinical benefits, we have the reversal of photoaging changes, plus we have the safety of not going too deep. Because the target of this is water, it doesn't matter whether you're Caucasian skin, Asian skin, African American skin.
Prior to all treatments, patient preparation is essential. All makeup, creams, and lotions must be removed. During treatments, the clinician and patient must wear appropriate protective eyewear. Always pre-cool the area prior to treatment. Let's begin by showing a full face and neck treatment with the Affirm using the CAP technology.
We're going to be treating across the entire face. We're going to make sure that the eyes are protected, but once the eyes are protected, we're going to go all the way to the lower lid and right up to the margin of the eyelashes. When we treat around the eyes, what we like to do is to get a nice uniform redness. And we tend to really focus on the fine lines that occur on the lower eyelid. When we treat the upper eyelid, we make sure that we reposition the protective eye shield so that it's over the globe of the eye, and then we pull up on the upper brow and make sure that the eyelid skin that we're treating is over the bony part of the orbital rim. Typically, because the eyelid skin is thinner, we tend to be on the lower side of the setting. So most patients, the starting setting would be about 3, and we've certainly done periocular as high as 4 joules per square centimeter. So now we're going to treat across this lower half of the face, and I found that it is much more effective on lip lines if we actually pull up the lip and go to the vermilion border. And just like on the upper lip, where we want to go up to the vermilion border, we do that on the lower lip. And that'll help with those lines that otherwise lipstick would bleed into. Now if we want to go back and do a second pass, we can go perpendicular to the previous, and usually that'll end up covering any of those whitish spots, and it'll definitely look like a more uniform erythema.
We have been using the Affirm technology approximately 18 months. During that time, we've treated hundreds of patients with the Affirm, and we have seen impressive improvement in skin texture, fine wrinkling, and overall smoothing of the skin, as well as a great improvement in acne scarring.
The Affirm can also be used for other skin rejuvenation applications, including hands, chest, and scars.
What has become more evident lately is that because of the availability of non-invasive treatments for the face over the last decade, And with steadily improving technology, such as Affirm, people realize that their hands don't match the look of their facial skin. So what we'll do with the Affirm is we'll treat at about 3 to 4 joules. We'll do at least 2 passes. One of the benefits of the Affirm treatment for the back of the hands is that the skin actually becomes a little thicker. I think it really induces so much more collagen formation that it's not just surface texture, it's really the body of the skin, the body of the dermis. So with that we find that the skin loses that crepey look and kind of looks much younger than when we started. The chest, which is often overlooked, particularly for the application of sunscreen, so we often find that, just like with the hands, patients have had very nice results on the face and have had a very nice textural improvement. We've had very nice success with acne scars, and this is with all types of acne scars, whether they're crater form. But we've seen excellent results. We tell patients to expect also it's a series of treatments, usually a minimum of 4 to 5. It may be as high as 10, but they will see dramatic improvement, again with very little downtime. The other type of scars that we've treated are scars that we've seen after surgery, particularly on other body areas such as the chest or the back or the arms. We've seen patients who've had surgical scars that even are 10 years old and they're very sharply demarcated from the surrounding skin. We found the Affirm is very effective at blending those scars into the surrounding skin. So it really opens up a whole range of treatments, because previously we would treat scars mainly that were red, that were fresh scars, but with this technology we're able to remold scars and sort of give it a second chance to heal, and to do it in a way where it really has a very nice blending effect.
The new Affirm platform also offers the advantage of being purchased up front with an XPL handpiece, or with the possibility of upgrading at a later time.
With the XPL, we're using intense pulse light system, and this is a unique system that has a sapphire crystal and has integral air cooling, which is a combination of air cooling and contact cooling. So we find that patients have very little sensation of heat when this device is applied, and the XPL works really well on pigmentation and on telangiectasia in large blood vessels. And the application technique for pigmentation is usually to press against the skin and actually eliminate blood from the capillaries, and we get very specific pigmentation improvement. Typically patients will see a reaction where the brown spots turn darker and peel off within a several-day period after the treatment. Again, with this device used in conjunction with the Affirm, we can actually treat not only the surface of the skin with the XPL and treating the pigmentation, but we can actually go to the next layer, go down several hundred microns, and do that second level of resurfacing where we get collagen remodeling. Cynosure was the first with the CAP technology and the micro lens array, and I believe that that is the best approach to fractional-like resurfacing. With a higher density spacing of a fractional-like stamped pattern, you will get the greater risk of epidermal injury, which means risks of increased pain and blistering of the skin. With the density of the pattern of microthermal lens array and the microthermal zones that are being delivered by Affirm, we find that with a single pass, because we have 1,000 of these microthermal elements per 1 cubic centimeter, that we can do with one pass what it will take 4 to 8 passes with other devices to achieve.
I'm very comfortable recommending the Affirm treatment to other physicians. For physicians who have experience with more invasive lasers, they'll be very pleased to be able to get similar results without the pain, recovery time from the patient's point of view, and the much greater ease of the treatment itself, with a greater margin of safety too, and many fewer complications.
The Affirm with Cap technology, the future of anti-aging procedures today. For more information, please contact Cynosure at 1-800-886-2966 or visit us on the web at www.cynosurelaser.com.